at CUNY School of Public Health. I currently work as the Special Projects Assistant in the Office of Career Services here as well. Welcome to the Arts Breakout panel at Public Health Everywhere, Non-Traditional Career Paths. It's my pleasure to introduce our moderator for the next hour. Véronëque is the founder of Brooklyn-based action group Creole Collective, which optimizes arts practices rooted in oral history and movement, public health, and community organizing to improve community health. Véronëque also serves as the New York City FloodNet Community Engagement Manager and is a PhD student at CUNY School of Public Health. Welcome.
Hi, everyone. I'm going to speak really loudly. Can you all hear me? Is this level okay? Okay, wonderful. I'm really happy to be here and to be representing my school as well. I'd love to start by introducing the panelists. We have today Andrea Isabel Lopez, who is a CUNY SPH alum and project manager at the Latinx Arts Consortium of New York. Born in San Juan, Puerto Rico, Andrea is committed to advancing health equity for the Latino community and also serves as a civic science fellow with Ciencia Puerto Rico. Thank you. We also have Darnnell Dorvil, also known publicly as Storyteller Gordon, who is a public health professional, writer, spoken word artist, and founder of Form NYC, a nonprofit organization established to foster a positive and healthy understanding of masculinity, which I'm sure we'll talk more about later. And we'd like to welcome back Larissa Trinder, who is part of our morning keynote and is the Assistant Vice President for Arts and Medicine at New York City Health and Hospitals. So thank you all. We have some questions to start, but I think what would be really great, since it is an intimate group, is if you could all just maybe share one word or one sentence or thought for what you're thinking about as far as public health and the arts, and what is bringing you to bridging those two things together.
The word community comes to mind a lot of the work I do, and I'm sure I'll ramble about this in a couple of seconds.
I would say essential.
I would say fearlessness.
So why don't we jump into it? What for you all, given those words as well, is the connection between art and public health? How do these two different disciplines work together? How do they strengthen one another?
I'm always gonna let one of the ladies go.
I feel like I just talked so much, so I'm like,
I'm happy to get started. So, as Véronëque mentioned, I'm the manager with the Latinx Arts Consortium. So I work with a bunch of different cultural institutions and Latinx serving institutions in the city. And I can give you like a very contextual, like concrete connection between the arts and public health. If you literally go to our website, there's a facts tab that gives like a bunch of data on what's the connection. Like there's a very clear connection between reduced obesity, improved educational outcomes, mental health outcomes, child neglect. Like there's like reports that validate this information. So that's more me trying to give you guys like the academic citation that you can use to validate the connection there. But from what I see from a lot of the organizations I work with, there's just something about being, especially, I mean, I'm Puerto Rican, like I know when I walk to a place, then I can like bring my full self and I don't need to like minimize my boricuaness or like my hand gestures or how I talk or anything like that. I can't emphasize enough how beneficial that is to your mental health, just belonging. So that's just one example. These organizations are also like employers. So there's like the financial side of things that connects to to public health. Yeah, I can go on with more examples, but I will pass it on.
For me, art is driven, connects with emotions in such an uncensored way that when you create art and someone else connects to it, it allows you to bypass a lot of the barriers that tend to be social determinants of health. So even as a man, when I'm honest about my truth, when I get on stage, I'm always interested in how many people that don't look like me identify with what I'm actually saying because of the vulnerability. And I do that as a Black male on stage. That is my lived experience. And when I walk off the stage, I get approached by white men who connect with me, by women who have empathy with me, by people who are not the same gender as me or the same, or share the same sexual orientation as me. And it's a beautiful thing. And I think by doing that, we can, one, learn to understand each other, but also, again, reducing that barrier to really educate one another.
I think, and I'm trying to think of some examples that are a little different from what I gave downstairs, but I recently entertained a group from Stockholm School of Economics. They were in the city for a week-long business meeting, and they reached out and said, we really want to learn about what you're doing with the arts. And I felt this there. Okay, because we entertain academic groups all the time. They want to come and see our WPA murals, and they're interested in it. So this group came, what I learned that they were doing that was so amazing. And I'm sitting here looking at these frankly really lame blank white walls. And and you can look this up. The Stockholm School of Economics engaged artists in their community to come in and redesign the classrooms in their leadership school and their business school. And they did it with a lot of strategy, and I won't get into it, but they're amazing. And so if you can just imagine for a minute that you're sitting in this room right now, you're listening to me, you're tired, it's late morning, whatever. And if these walls were filled with, what we have at Harlem Hospital is so extraordinary, but beautiful murals that reflected this community, that reflected shared experience, that reflected New York City, you would be, you're all very engaged and obviously attentive, but you would be even more engaged in what Stockholm was studying, is that it was actually enhancing learning outcomes by having these classrooms. So I think there's hopefully a shift in intentional design space and how we're looking at, architecture and artwork as not just something to beautify or to even soothe, and that with study with physiology, but to truly, how did the students at CUNY School of Public Health, will they interface with this artwork? We should do it and study it because it really, I think is they're onto something.
So I think something that we were able to hear, at least downstairs, and from my conversations with you all before this panel, is that we're all coming to this very differently, right? Where we've had different professional experiences, maybe personal ones, that are shaping how we are engaging with the arts and the public health space. So I'd love to hear, for those of you that have done this sort of formal public health educational training, a little bit about how that has prepped you for merging these two or working at the intersections of the two. And Larissa, I'd love to hear from you, just from your experience doing this work at Health in Hospitals. What has it been like coming to public health in this way, or now working or being exposed to public health in this new way?
You all go first, or do you want me to go first? I can jump in again quickly, because I graduated with an MPH from this school. I always describe public health as a pretty expansive field, you're pulling from a lot of different disciplines, you're tackling a bunch of different issues. So the training that you receive as a public health professional is almost you have this toolbox of a bunch of different things that you can pull from. And in the context of my work with Latinx Arts Consortium, we're doing a needs assessment to get an understanding of what are the needs, the assets, the wants of our broad network, then translating and analyzing that into a report and then creating a common advocacy agenda. So because of my public health training, I'm pulling from data analysis and qualitative and quantitative stuff. I'm pulling from the community-based participatory research side of things. I'm pulling from communication, I'm pulling from policy. So because of my public health training, I basically have a pretty broad toolbox. And I don't necessarily know that I would have that toolbox if I didn't have a master's in public health.
For me, it's twofold. Initially, it's identifying things from a public health lens. Understanding that if something impacts me, chances are it's impacting a whole bunch of other people. And understanding how what impacts me might impact someone else gives me an idea of what solutions work for me and how I might be able to implement those solutions to help others. Second is the theory of plain language. Understanding that we have to be able to connect with everybody in the room. As a writer, I love showing off in terms of my English, my verbal lexicon and using big words, but that doesn't always serve me. For a lot of people who tend to do poetry, they want to use big, beautiful words. And I do exactly the opposite because I want someone to understand, even at the very limited perspective with a limited vocabulary. I want you to connect with me. And based on that, I know that I can help you or you can understand and empathize, sympathize, understand the gist of my work. So those are those two principles I use intentionally from public health.
I think that you're really lucky to be in school for public health, and I think that, I don't know if I'd say if I could do it again, I think that we talked downstairs about how we all have this sort of, different journey. But I do think that listening to the two of you as well, there's a lot of skills that you learn in public health curriculum that can certainly be applied. And I was, as I mentioned downstairs, I came into this sort of through the development and nonprofit door and public policy. And that certainly prepped me in a different way. And because I'm like literally embedded in the middle of this health system, I've learned a tremendous amount about some of these things, but I had to like learn them along the way rather than having that as a toolkit for myself. I'm still learning.
I think a lot of that resonates as well. Hearing some of the conversation downstairs that was bringing in the arts, and from you all, that the work in progress aspect is part of it, right? It's part of the learning, and identifying what is working, how is it working, and the why of what it is. So I'd love to take a little bit of a step back and come back to this idea as well. If you could each give us a little bit of a small recap of one thing that you're actually doing, whether it's, what form is, or what is a campaign that you have that kind of represents this. Same thing as the consortium and of course, arts and medicine. And then speak a little bit to what the role evaluation and assessment plays in that, right? Like how do you know that you should keep doing it or keep going?
Yeah, I guess I'll get started here. So one of the campaigns and one of the reasons why I'm sitting on this panel today is I started a campaign on stopping street harassment. And it was geared towards men, written by a man to protect women. One of the reasons why I started Forum was I understood all the things that women do as they walk down the street to protect themselves from men. These are things that most men are not even aware of. If she holds her keys in her hand before she gets to her car, 20 minutes before that, she carries that mace. These are all things. So I wondered, what are some steps that men could do to be more cognizant? So when I walk the streets now, I always walk at an angle. If a woman is walking in front of me, these were things that I do, but how do you push that idea forward in a small way? So I started with a series of haikus designed to have men become more cognizant of what might be viewed as street harassment from a woman's perspective. So that campaign, I think, is one of the things that I did intentionally. And in terms of assessment versus evaluation, for me, assessment is how I view the problem and how I write about that. And evaluation is how people receive it, right? Obviously, you want to have more data-driven details, particularly when we want to evaluate the efficacy of it. But that is how I do it on just a natural level.
Yeah, I can also speak to the evaluation side of things because right now I'm analyzing a survey that we did of like our network, and I've conducted like a bunch of one-on-one interviews and focus group interviews with the directors of like all of these organizations that we work with. And there's like the number side of things, like how many people are impacted or served, like how many sessions they run after school programs, K-12 audiences, like that very concrete numbers thing. It's useful like when you're applying for a grant or like have to do a progress report to a funder. They love this kind of like very concrete numbers information. But what I found most useful is specifically with one of our partners, Emerge NYC. I've been doing an evaluation of their program. They run like a yearly cohort-based program that they give like all of these resources and classes to different artists. And their philosophy is I think they're like the crazy kids out of like the cohort of like all of the organizations that we work with, because they're not interested in outcome. They're much more interested in process and have like a very dare to fail mentality. So they're just very creative and approach arts in a very unique way. And when you talk to all of them, they really talk about the impact of, yes, immersion on their careers, but it's also like outside of their careers, like having this group of people that they can rely on. They talk about escaping like abusive relationships, surviving like different life circumstances. And I think this shows the real value of a lot of these programs outside of just the numbers side of things, and things that aren't necessarily as tangible. And I think this also speaks about how we talk about evaluation, even like what we consider valuable or what we consider impact and success. So yeah, I that's kind of where I'm
Yeah, I
coming
mean,
from.
I think the research and evaluation piece, particularly when it relates to the arts, is really challenging and interesting, and it's really getting to be in a better place. There's some amazing, so there's like the non-quantitative kind of anecdotal ways of knowing that you all are talking about, but then there is also some really, you really do need some outcomes. So there is there's some really interesting work coming out of Johns Hopkins by a woman named Susan Magzaman, and she has been looking at she's really been defining this space called neuroaesthetics. And it's really taking neuroscience principles and neurologists and thinking about the physiology of what's happening when you're having an art experience. So some of this we've known for decades, like art observation, and decreases your cortisol levels. Cortisol is that like fight or flight if a bear is chasing you in the woods and your heart rate goes up. Or in my situation, if people are coming through a hospital, you're really stressed. So how can we make that journey for them lower? And I mean, I am about to do some saliva swabbing on one of our programs with some of the participants to sort of test these things. But I think too, you were asking about kind of a particular way that we know and give an example. And I think one of the most recent examples that I'm most proud of is we decided about a year ago, we were going to do exhibitions. Oh, we have this great art collection. Let's do exhibitions so we can create greater access and whatever. And that kind of iterated into, wait, they're doing something really interesting on Rikers Island with our correctional health services, with our creative art therapy program. Let's get those creative art therapists to develop projects with these incarcerated individuals, and then let's juxtapose them next to pieces in our collection and have like this great exhibition. Well, it was like full year in the making, and it's still up. It's at our Woodhull exhibit in Brooklyn. But it was a really powerful exemplar of how the arts kind of bring this community together. It highlighted not only the humanity of the incarcerated individuals, but the correctional health service workers that are also tremendously important to our health system. It highlighted the art, their artwork. It highlighted the art therapists, creative art therapists. It highlighted our collection. So this entire project was able to do all of those things, and by doing so was able to illuminate the challenges around incarceration and how we can destigmatize those experiences for those individuals. And so the arts have a profound way of being able to talk about complex stuff and raise awareness for things that are hard to raise awareness for. And artists can kind of get away with stuff. Like they can do these things in a way that others can't. So they're really wonderful.
I actually love that you said that artists can get away with stuff.
Articulate.
I'd like for us to sit on that together. And maybe we can start this time with you, Larissa, to talk a little bit about the artists that you're collaborating with and what that relationship is with the people that these programs are meant to support, right? What is their impact on the health and well-being of those people? Just if you could speak a little bit more on that. Yeah.
Yeah, I mean, one of the programs that comes to mind that's not new to anyone, probably, but I'll explain, is an artist in residency program. And an artist in residency is when you embed an artist like every Thursday from 9 to 3 in the Bellevue Hospital. And we have a pretty robust, it's called AIR for the acronym program. And we have one artist in particular that is going to be embedded in the Bronx and Jacoby to really be working with a little bit patients and youth, but really the staff that are dealing every day with the hospital violence prevention program. So they're under this kind of pervasive trauma as well, trying to really de-escalate these very complex situations. And so we've been talking to this particular artist, and we're sort of thinking about how are we going to evaluate your role this year, and how are we going to know if it works. And there's a variety of different things that we're coming up with to sort of measure that. But I mean, that's just one example. I think that artists and residents can really become a very important part of the health system when they're there for a consistent period of time like that, like every week, and they know that they're there.
Darnnell, Andrea, do you have any thoughts on artists that you all are collaborating on, and this idea of artists getting away with things as well?
That's part of the reason why I use the word fearlessness at the beginning. Art actually needs to stay fearless. Not only because that's how we bridge gaps, but that's how we push certain conversations. I've had the pleasure to be influenced by so many artists as a writer and as a storyteller. So hearing other individuals' stories, that, you know, that's what pushes my pen in a sense to continue to create, to continue to write. And I've written stories that I didn't even know that I felt these ways until I confront that on a page. And as a result, I host an event actively called An Evening with Storytellers, where I give an individual 15-20 minutes to really speak, range stories together, put those stories together, and provide a safe space for someone to tell their truth. At the end of it, what always happens is compassion and empathy, regardless of how I begin the story. So I think that collaborating with artists is a huge undertaking, but at the same time, it's such a co-learning experience.
Yeah, touching on that co-learning experience, in addition to working with the Latinx Arts Consortium, I also work with Ciencia Puerto Rico as a civic science fellow. Ciencia Puerto Rico, like the whole goal is to put science at the service and at the hands of Puerto Ricans. And I collaborate with them on the public engagement unit, and we've created a bunch of different public health campaigns. And the way we craft the campaigns is very different than what the Department of Health of Puerto Rico would do. Like, we have an in-house graphic designing team that we work with. So the visuals and the artistry side of it isn't an afterthought. They're very much embedded in what messages are we crafting, what campaign are we even pushing out, literally everything. And I wish I had visual examples to compare what the Department of Health does and what we do, but the Department of Health could never. We are the visuals are just amazing. The colors we use, the phrasing we use, everything. It is a very different approach to how we do public health campaigning. And then we also work with a cohort of community, we call them community ambassadors or community leaders that represent a bunch of different communities in Puerto Rico. And they serve as the communicators who push out the message. So we've had some of them do murals in their community. We've had some of them do t-shirts with the messaging, which in Puerto Rico, t-shirts are a very big thing. So having a t-shirt that says aquí nos cuidamos or prevención or anything like that is very cool. We've had one of them do a poster kind of exhibit in a bakery, which sounds very crazy, but bakeries in Puerto Rico a lot of times serves as community centered. So that's to say that I think this is a great example of how we can do public health kind of in an out of the box kind of way.
Can I just add to, you just made me think of probably, at least I think it's a really perfect example of this. We, about a week and a half ago, had an artist in our community mural program develop a massive mural for Lincoln Hospital. And Lincoln Hospital has this really insane history with the Young Lords in the 1970s, sort of seizing the hospital. Many of you are probably aware, and thereby basically rebuilding the hospital to what it is now. And so we've been working with this artist for months and months. His name's Mr. Rondon, and he was a little bit of a dissident. He would kind of always be pushing the needles a little bit with me, and I'd be like, oh, So I go last week, he had like canceled when it was gonna be installed and everything, whatever. So I go last week and I walk into Lincoln Hospital at 9:30 in the morning. The whole ribbon cutting starts at 10 with elected officials. It's like this big thing and whatever. And the whole thing's behind, they had just installed it like the day before and I was like, one of the first ones there. So I undo the thing and I was like, oh my God, this is a totally different mural from what he did in the community mural paint party 3 weeks ago. And it was like kind of similar, like it had he wanted more of a Puerto Rican representation and African-American, and they had these two individuals that were in the main one with this African-American woman holding this baby, and and there was roses, and it was really beautiful. Well, it was like 4 more figures, and it was frankly incredible, like shockingly beautiful, what he did, but he completely used his sense of agency as an artist to do what he felt was right, even though it was kind of against the rules. Like he had asked, like, hey, can I change it? I'm like, kind of can't. It's like sort of part of our process. And he didn't listen to me. And I have to say, I'm kind of glad because it's just really, really incredible. I suggest you go. It's right in the lobby of Lincoln Hospital.
That's that fearlessness I talked about.
Totally, totally. He just knew, he knew.
I think there's something that is implicit in this conversation and questions that we should make time for at the end, but not now. I want to kind of seed it is we're talking a lot about arts in public health space, right? But there's something about public health in the art space. There's something about thinking around what is formal and not formal in the art space that is going to be impacting the way that we're kind of incorporating the arts in the health space, right? When you talk about what's against the rules and what's not against the rules. So I want to seed that now so we can kind of start to think about it. But to get us there, Andrea, I'd love for you to talk a little bit about whether it's with Ciencia Puerto Rico or the consortium, in your work with this data, in your work occupying the space that you do, speak a little bit to what it's like contextualizing art in those spaces and balancing that knowledge that there are 2 approaches for how the health department might do something or a traditional health institution might do something versus what you've been encountering.
Yeah, so specifically with the consortium with LXNY, in all of the conversations that I've been having with a bunch of the different directors and staff at the organizations, we're basically trying to get a sense of what they offer and what they need. And a lot of times, to me, it's like very obvious that they're doing public health. But when they talk about it, that's not how they frame it. And it's not like, it's like hard to convince them that they're doing public health, but it's almost like you need to walk them through and like help them make that like shift that, oh, this after school program is in fact improving X or Y public health like outcomes, or this art exhibit is like creating a safe space for the community to come in and we could leverage it this way to improve public health outcomes or whatever the case might be. So it's been very interesting to see all of these examples of really public health, be it like a exhibit, theater, like a play, a concert, anything. And how when you like talk to them and you're like, oh, so you're doing public health, it's almost like oh crap, yeah, I am. I'm doing public health. So I think it like opens up a world to them that they hadn't necessarily considered. So yeah, it's been kind of cool to kind of not retrain them, because I don't want to say like I'm retraining them, that sounds wrong, but just like making that like mental shift in a way and kind of communicating the broader impact of the arts. Because a lot of the directors are artists themselves that are just like coming at it from like, I want to do this exhibit and curate this exhibit. But really they're just communicating like a public health value. And also like Latina art, I think there's like an urgency and the message and like there's like the goal is usually different than like what you see at like a Met or a MoMA. Like there's like a representation and belonging component to it that can't be separated. So I think that adds to like the public health impact that it can have.
Right. That also resonates, right? It's the context that is building out the art and what that could be for its impact, right?
Yeah.
So I want to come to Darnnell for a similar but different question around how are you ensuring or what is the process of making sure that the things that you create with form are tailored to the communities that are meant to receive it and that are meant to have this experience. And before I let you answer, I want to say for the crowd that you also have experience working in the hospital space and at the institutional level, the sort of like worlds apart from what you've been describing. So if you could frame that for us as well and then answer the question.
Thank you for that segue, because initially I used to look at it like I serve two masters. I work in hospital administration, and then I'm an artist over here. I had to stop looking at it that way, and I had to view it as I have to be my one true self. And that allowed me a little bit more space to understand that, again, if I approach this fearlessly and genuinely from my aspect, I can actually help more people this way. So, during the pandemic, I was an emergency room supervisor. I'm a business operations manager at the Hospital for Special Surgery currently. But then I'm in the diversity, equity, inclusion group at work. And even recently, sorry to make this long-winded, but recently I had an opportunity to perform at an event at my hospital. As a result of performing at that event, there's a new position there starting as a health equity manager, because I have understanding of the clinical knowledge at emergency room. And it's funny how your life will begin to come together almost synergistically when you become your one true self. So when I look at form and how I put it together, first it's understanding who I want to serve. It goes back to plain language. Who am I talking to? With every time, who am I talking to? The focus groups that I arrange before we host these safe space events, and understanding what it is that these men actually need, how many men we've navigated to therapy and mental health resources. Those things are important, but also there is what we're not looking at, because what men want to talk about isn't always what we need to talk about. So that's when things like the Stop Street Harassment campaign comes, because there is a blind spot, and being cognizant of our own blind spot can allow us to help more people and help ourselves as well.
And just not to pull your leg too much, but in the space of understanding, let's call it standpoint, and how that, using yourself as a reflection has helped you guide the things that you do. I feel like it's really important to ask which men and what you mean by when you're thinking about masculinity in this way and using all of your communities and environments to kind of guide that work.
Yeah, it goes back to what I alluded to earlier in terms of identifying things from a public health lens. I understood if I was going through this, me with 2 degrees, and I'm confident, and I still have certain insecurities, and sometimes I still struggle with mental health. I can only imagine people who don't have all the education I have, all of the assets I have, my good looks, all of these things. Someone who doesn't have that, I can only imagine what they're going through, and how can I help him? And how the ways that I've learned to help myself, how can I pay that forward and help others? So it started as my true experience, my lived experience, and understanding how, looking at things from a public health lens, how can I use my experience to help more people?
Do you have any thoughts about that, Andrea or
Darnnell
Larissa?
space with a view. Well, I was thinking the whole time, around how here we are in a school of public health, and you're talking about the arts and the role and how it's important. But do art schools have public health classes? And are art schools thinking about telling artists and teaching them what their potential role could be? And I know the answer is no, because my middle son went to undergrad art school. He's at School of Visual Arts now. And I'm, he knows what I do for a living, so I'm always making those connections for him. But even then, it's still sort of like a little bit peripheral. So I think that looking at curriculums and being more interdisciplinary, and maybe it's the School of Public Health here, goes to School of Visual Arts or whatever, and talks to these students, and you all can kind of work together on thinking about these problems, because artists are problem solvers, but if they don't understand, like, we constantly, whenever we get a new cohort of community mural artists, one of the things in orientation is teaching them why art's in health. And it's really explaining to them, a lot of them are incredibly talented, seasoned artists that you've seen all over the city on public murals, but they haven't been in a healthcare setting and they don't realize that what they're about to do is going to have a profound impact on that community. And so it's just sort of a comment rather than any kind of major notation, but just to think about why that's not the case.
Yeah.
Um,
I have a lot of thoughts about that. And I think it's a great segue into the next question, but I feel that it might be helpful just for me, just to get a show of hands, like how many people in the room, and I can't see the Zoom, but like how many people in the room are identify as an artist or have a creative practice? Cool. And how many of you maybe are definitely public health and just curious about the arts space? Okay, so that's really helpful because I think you're leaving us with a call, right? Especially at SPH around who's doing this work, what does that integration look like? And so before I segue to the next question, myself being a student at SPH, a dancer, someone who identifies as a social practice artist, I think a lot of what I'm always thinking about is well, whose art, what type of art, right? When we're thinking about formal education and the way that it exists, including even at SPH, right? Being in a doctoral program, inherently in there, maybe ideas or themes or practices that are maybe antithetical to the types of arts practices that do exist that already embed arts as inherent, right? And so there's a lot of that as well when we're thinking about making space for public health or within public health for the arts, but similarly making space within the arts for public health, right? We're going to always be in that fight, and it's multi-level, and there are many questions that we need to ask ourselves. So I think the next question is really just to capture your thoughts on what do you think is needed to do that work. It's a lot to unpack, and so it's okay if you take a minute to think about it. And for those of you that are artists in the room, regardless of how you came to that training, I think it's work for all of us to do, right? From the space of being trained as an artist, whether experientially or formally, like what is needed?
I want to say the very obvious thing, just because we need to get it out of the way. We need more money for this kind of work. And that's not to only for like the running of a program and like maybe continuing it or like making it like a broader impact or whatever. But this also goes into how we evaluate the program, how we communicate its impact, who we have at the table, like can we, if it's a 2-year program, can we do it for 5 years? Like there are bigger implications here than just like the actual running of a program, but even like publishing in a journal article, like the impact of X or Y artistic or after school program or whatever the case might be, you need money to pay like the researcher to get like that expertise, get into the journal, time to do it. There's like a lot of money.
Maybe also money to pay the artist.
Exactly,
right?
yeah. So there's like, definitely, so there's like a lot of issues here that will be solved with more money, basically. I can let you guys speak. I just felt like I needed to say that.
I think that, and I think, but I also think that's very ideological because it's like, it's gonna be we're always gonna be trying to get funding for these kinds of things. But I think that what you said about, research, evaluation, and impact are really important, and then policy. And if we can continue to show the evidence that the artist's role in a healthcare system, for example, is correlating with outcomes or retention of the workforce or contributing to the Maslow burnout index and creating a better experience for healthcare workers, then I think the money could potentially come. And I heard a really frightening trend the other day that by 2040, there will not be enough healthcare workers to care for the population. And, if we don't get ahead of that now, it's not that far away, by thinking about all these different innovative ways to support our healthcare workforce, and the arts is like, hello, one of these really wonderful ones that offer so many benefits. So I think it's research, evaluation, policy change, to sort of shift the paradigm and make the arts kind of an integral part of the system.
You didn't leave much for me to add. I'm going to say innovation.
Yeah.
Not just in how we collect the data to gauge the efficacy of art's involvement, but also innovation on behalf of the artist. I think there's a natural, and it comes back to fearlessness again. I guess I chose the right term. But there's always going to be a point where you as an artist will feel like you're the only one who sees the correlation between what you're creating and what impact you want it to have. But you can't minimize that or slow that down in the middle of that process. So continue to be innovative, continue to find a way. You're gonna be the only one who sees it at the start of it, but you have to see it through and hope that at the end, you get the funding and you get the data and everything to corroborate how you've envisioned this in your mind, but initially you won't see it. And what you'll end up doing is watering your art down to something that's already been done. So continue to be innovative.
So with that, we have a few minutes left in our panel. Are there any projects or thoughts or anything at all that you'd just like to leave us with, whether it's something you're working on or final thoughts that you'd like to share?
I'm a nonprofit organization. I'm always looking for funding, so head to my website, find a way to donate. That's great. But I also host events, so you can connect with me via any social media and check out any of my events. We're always looking for people. That way it's easier for you to patron. You get something back from it. We get some funds from it, and you get to have a great night experiencing the art that we supply.
I can talk about something that we just finished at Ciencia Puerto Rico. We just published a book. It was supposed to be like a little pamphlet. It ended up being like a long book. Yeah, we got too into it. But it focused on the public health campaign project that I mentioned, and it's basically showcasing all of the community leaders that we work with. And I think the way everything is framed, I think challenges a lot of our knowledge of like who does public health and how it's done and who's an artist and who's even welcomed into these spaces. Because we're really letting the community leaders kind of tell their own stories without us coming in and trying to like curate it in a way that like fits a specific mold. So we're very proud about that. It's in Spanish, so I'm sorry if you guys don't read Spanish. But it's in the Ciencia Puerto Rico website. I'm happy to share the link and any context if anyone's interested.
I think I mentioned this downstairs that we're on the Bloomberg Connects app, and we were really excited to go on it as the first healthcare one. And then the other more affluent health systems like HSS and all the others are sort of trying to get on board now. But, you know, that's definitely a place as we're constantly building that out, that we'll share our exhibitions, our programs, come to any of our community mural paint parties, internship programs and other things that we're doing. And please let others know about it, because the Arts and Medicine Department at New York City Health and Hospitals is really kind of a singular entity, and we're really trying to develop a framework that can be scaled to other health systems so that they too can understand where they should be situated in the system and how they can deploy these kinds of programs. And I mean, back to, I guess, the funding comment, my department wouldn't even exist without Lori Tisch. Her Illumination Fund recognized about 5 years ago the wanting to do something with art and health and the gap in the public system. So she really wanted to support that. And we have some other funders, but she's really the major funder of this initiative. And so you're absolutely right. I mean, we're very fortunate to have that. But I would love for everyone to just spread the word about the importance of art and health kinds of modalities in health systems. It's really, really important, because they're still kind of like, wait, what do you do? You know, people always ask me, like, what do you do again? So.
Thank you all. Thank you. With that, I think we can open it up to questions in the room. Yes.
Yeah, I'm sorry, I've been thinking about this all the time. So I've been a public health nurse for 35 years, and we're really good at delivering information, right? You know, so right now we're having a problem with measles, and we like science, and it convinces a lot of people, right? Because it's a very contagious disease. It can be deadly, but it doesn't convince everybody. So what do you think the role of art is in trying to move some people who are not moved by science, who might be moved in another way?
What system are you?
I have worked for 3 different county health departments. Currently, I'm employed by the Westchester County Department of Health.
systems have different ways of doing this.
Like on a more macro level.
But yeah, so I can give you a very similar example. You know, we have a program called iCare, which is for asylum seekers coming into New York City. It's like an insurance card that they have for a year. They can get it immediately and they can access all of our services with regardless of any circumstances or funding. But we're doing a rebranding right now because it's just been a while and we have a lot of new people in our community that are coming in. So one of the ways they reached out to Arts and Medicine at the hospital was to say, hey, we're doing this whole thing. Do you have any immigrant artists that you work with, which we have a lot? And would they be interested in helping develop the rebranding campaign for this? So we're sort of in the process of doing that. But with the measles, like, oh my gosh, an artist could very easily, come up with a really compelling campaign that worked with that community that needs to sort of be more, feel more connected to why they should be getting these shots, and it should be speaking what their experience is, obviously. So I think that's a great example, though, of how to use an artist to do things. Because I mean, the health system can all day long send out PR and social media posts and get your vaccine and like even me, I work there, I just like gloss over it. But when an artist is saying it, or an artist has some sort of soapbox, we all kind of listen because it's frankly just more interesting and it resonates.
I can speak also about the public health materials that we've created with Ciencia Puerto Rico, because I'm 1000% sure that, oh, sorry. I'm sure that what brings people in isn't like the vaccine messaging. It's the visuals, the wording, and that we use kind of the visual art as like the hook that brings people in. And then the public health message, it's not an afterthought, but it's just like it just comes with it as an add-on. And what's been very successful for us, I can speak about vaccination specifically, because we work directly with different community ambassadors, community leaders, and community health workers. We're basically giving them the training and the materials for them to kind of use our materials in any way that they see fit. That's why like the mural example or the t-shirts or like turning a bakery into like an art exhibit it wasn't our idea to do it. We were literally just giving them the tools and the funding for them to go do it. So I think a lot of times relying on kind of these outside people in a way and giving them the tools to impact their communities is important. And we even had one of the community leaders who did not want to get the COVID vaccination. If she would walk people to the vaccination clinic, convince them to get the vaccination, but she herself did not want to get vaccinated. Eventually she did, which was but I think that there's also, I think, about persistence and like prolonged engagement there that sometimes a simple conversation just isn't enough. Seeing the story of like, all of these people got vaccinated, no side effects. Everyone in the Ciencia Puerto Rico staff got vaccinated, no side effects. That's sometimes just like that personal side of things also has a bigger impact as well. Yeah, I think I touched on like a bunch of different things.
There's a question here, and then Red Jacket, you had one as well. Okay.
I'm sort of like sitting with what you said, Darnnell, about how you initially, or, maybe, it's a journey, right? Sometimes like view yourself like as a health administrator and then as an artist, and that's sort of separate, but the power of thinking about it in unison and as one true force. And I think I would say probably all of you on this panel feel similarly. I guess, regarding higher education, and it's okay if you don't have like a perfect answer, and this is a question for everyone, a perfect answer to this question, but, Larissa, you talked about how, there isn't public health classes in art programs, right? And to my knowledge, while I think like this class is like very great that it exists, I don't know if there's really like an art times public health degree, right? So, for instance, like I am someone who actually very similarly am interested in using media and art to sort of sell a lifestyle, sell a vaccine, measles, whatever it might be. I guess like what would your recommendation, and I'm not a student at SBH, so what would your recommendation be? Is it, sort of do I go and get an MFA? Or do I go and get an MPH? You know, where do I, but because the combination is not gonna happen unless I really pitch it and go.
I think you would first
Get
have
funding
to,
for it.
I think you would first have to prioritize exactly what it is that you're trying to accomplish. For me, when I went to go get my MPH, I didn't think at all as an artist. I was in healthcare. I wanted to stay in healthcare. I just happened to run into a professor, Professor Dr. Dill, who ended up incorporating art in a public health class that I was in. And she realized that I had a knack for this. I had always been an artist, and she pushed me right back into the art space because actually I should have never left. Actually, I always belonged there. So honestly, it really does depend on where you would like to focus. And I'll go back to the question before this. If you give an artist a prompt, you would be shocked at when I'm commissioned to do or to write work as a spoken word artist, the amount of detail and research that I incorporate into doing that. I can educate, it's to educate somebody who has no idea about what this is. If you tell me you wanted to pay me to write a piece about measles, I'm going to deep dive into measles. I'm going to give you back a piece that will educate the standard person on a measles vaccine.
It might be a high.
In plain language.
Very effective.
It's, you know, I'm not sure how effective it's going to be, but it might be more effective than what is a standard pamphlet.
Right.
And how many of those do you print? And then you can run this ad wherever you want, or you can put it on YouTube and see how many people it connects with, how many views it gets. I get thousands of views. I have a video on YouTube doing 800,000 views about men's health during a breakup, men's mental health during a breakup. I didn't know it would have this impact. So you give an artist a prompt, see where it goes.
I want to jump in as well, and I know I haven't been contributing to the conversation much, but I think for both case scenarios, both of you, I think you've shared that you're already doing work in the public health space. Yes. Say it again.
Decades.
Decade. So I think the question should really come back to you all, right? Because there is something really important to be said about the kinds of arts that exist in the world that can be useful, right? And those are all forms of learning as well as tools for communication. So there's something happening simultaneously that we're kind of just assuming is real, right? Do you need to go to a formal school to learn how to do art? Many art practitioners are not in that bucket for many reasons, right? There are many barriers to formal education and what that means, and that doesn't necessarily validate the kind of art that you make. But when you're showing up as practitioners of public health and people that are doing this work, you're already showing up with this sort of intentional and strategic way that you are learning about a thing, that you are communicating about that thing, and the why. The assumption has to be made as well that the art space is doing a similar thing, right? Not that the artist is coming in to share a message that you have determined yourself is needed, but that the artist understands is important based off what that process has been. So in the case of the first question, for example, right? Part of how you engage folks around vaccines or measles is understanding maybe why people are not taking that vaccine, right? And that would be a campaign that could exist very easily in a traditional public health space. The artist then is able to do a little bit more of a deep dive, right? But there are processes of how we do that, right? We have CBPR methodologies. We have even the example I like to bring up is photo voice. Photo voice is talked about as a community engagement method, but you never hear it talked about as an artistic method. But fundamental to that approach is photography. Does that make a little bit more sense? So I think it's really important to ask yourself back the question around like, what would the process have been had it been any other tool? So is art in this space a tool? Is art in this space something else? You know, is it a way of communicating with people, or is it just an activity? Another question?
Well, I also think just the one quick thing is, you know, having a trauma-informed background, and there's ways you can do that are not extensive, but a lot of our artists, especially those that are going to be embedded in, as I mentioned earlier, are like our violence prevention programs, have a trauma-informed kind of lens because they've had some training in that. So at the very least, having some, without maybe going to a full graduate program or whatever, I don't know your journey or circumstance, but having some of that is the reason we actually prefer to have those kinds of artists in our system, because they already are coming into it, maybe even understanding some of these things to begin with.
Can we have your question? I know you've been waiting. for
Oh,
some
no,
time.
it's pretty generic. I just wanted to know folks like contact information. I work with a youth programming and in my head, I was thinking of 1,000 ways that we can connect to work with our young people. We have about 20 young people that work on staff with us. And this summer we'll be housed here in CUNY. So we're really excited about that. But they do podcasts, they do PSA videos, they do campaigns on social media. So hopefully was trying to be interested in like connecting with folks.
Is it okay if we share that after?
Yeah,
we close?
yeah,
Okay,
go
great. Are there any other questions in the room?
Yeah.
Questions from the chat if.
Okay. Can we take this one and then take?
I'll try to be quick, but, I'm curious about, for those of you in hospital administration, if you address sound, because sound is really toxic in hospital settings. And it can be very healing, and I've never seen a hospital bring that in.
We do we do a little bit with that. Probably not maybe in the same way that you're thinking, with ambient sounds and things like that, but we have a lot of music, programming and, concerts in different ways. But I've seen a lot of that. And one of the things we've been looking into are having more immersive experiences that have sound embedded in them. So lily pads on a pond, like there's no real plot in this thing, but you see a frog jump, you see a bug, but that it just loops for a half an hour in the patient's room. And then you might hear like a few little, sounds here and there, but you're right. I mean, there's so many beeps and things that are just really, triggering and scary. And I think that more of that, and it's actually not an expensive thing because our systems are already set up to have these monitors everywhere. And, I've talked to IT about it 100 times about different kinds of ways we could be, putting these things through. I was thinking of it frankly more from an immersive experience, but what you mentioned, I thought, oh, there's sound to that as well. So you'd get both of those, benefits.
Can we have your question?
Sure. So first, Andrea, where can we find a link to the book?
Oh, it's Aquí nos cuidamos /libro. I'm happy to it's too many letters to spell out, but I can write it in the Zoom chat if that's easier. I can jump in right after we close here, yeah.
Yeah, and then there's two questions. One question the panel already answered, I think, but it was in regards to community engagement and power dynamics that arise between practitioner and community member. Andrea, you spoke a lot about how giving the agency and power and creativity to community members and artists there to really do the work, and you're just providing the funding and the tools. And you can speak to that, all of you can speak to that a little bit more if you'd like. And the second question is, are there any strategies that you all recommend for searching for arts and public health positions postgraduate for both of them?
So one question is about power dynamics between community and institution. The other one is about where to look. Yeah.
I mean, I can quickly tackle the where to look. I think I don't work in a hospital right now, but I did work in clinical research for a couple of years. And when you work in clinical trials, I think you're used to you have very rigorous way of doing things that you can't steer away from. If anyone has a specific thing in mind that they would like to do, in my experience, all of the directors I work with are down for anything. We can have a whole conversation about the funding and how well remunerated you would be at first. That's the issue here, going back to the money question. But the accessibility and the interest in doing projects, I can't think of any right now that would be uninterested in anything public health related. So if the person who asked the question has a specific thing in mind that they do, I'm happy to connect them to like anyone in the LXI network that might be related, yeah.
Yeah, I think a lot of positions that meld like public health and arts are going to be in either community-based organizations
Yeah.
and things of that nature. Otherwise, you kind of gotta find your own way and kind of plot your own course. Public health is a very vast field and you might have to find it yourself. And that's why I stated, continue to be your one true self. I had to make the position for myself. I had to found my own organization to make this happen. But after doing that, I realized how many opportunities came my way, and I have such a unique skill set that you can essentially set your own price and find a way to make a good earning for yourself. But you know, it comes at its own challenges.
So I think we are at time. I would say that if there are additional questions in the chat, it may be okay for people to contact you all and ask those questions. I think for the people that are students at CUNY SPH, if that is a student that's asking, my suggestion would be to decide first if they are interested in working in the justice space or in the research space. The Research Foundation at CUNY has a lot of different things that are always being populated there with phenomenal scholars and professors, plug for CUNY SPH professors that are always doing really innovative things. They may have roles that fit. In my case, I lead community engagement on a project that is between CUNY and the mayor's office, and I am very unapologetic about incorporating the arts. So to that end, there's a little bit of that fearlessness that's always being tacked on. If there are any other questions, I don't know if we have to like scoot out of the room really quickly, so feel free to come up and ask, but thank you all. And Abigail.
Thank you so much to our wonderful panelists. If you're